Now let's get your knee moving the right way. Hi, Dr. James Fager again for part 2 of my knee replacement video. In part 1, I talked about why what you're currently doing might not be working for you. Remember, oftentimes your health practitioner, despite their best efforts, will encourage you to push through your pain and actually end up preventing you from making progress. The goal after you've had a surgery like this is to increase your range of motion. But if you're doing the movements that are often suggested, your muscles are actually fighting back. The sensors of your muscles are on high alert, and if you're constantly pushing them to the point of pain and causing them to fight against the stretch you're trying to achieve, then you're not making any gains with your range of motion. You're just overworking yourself and causing pain and lots of frustration. So in part 2 of this video, I'm going to show you a more gentle way to move your knee in a way that doesn't send your muscles on high alert. This is not about pushing through the pain or holding a painful stretch for too long. It's about increasing your range of motion in a comfortable, physiologically appropriate way. Before we get into the stretch I want to show you, you need to know that this movement is intended for a broad audience and it covers my most commonly observed mistakes. You may require more specific attention. Also understand that if I was working with you one-on-one, I would be able to provide treatment and guidance on all of the facets of your problem. There is much more that goes into solving your problems that encompasses your whole body, and I encourage you to check out my other videos for a more comprehensive approach to solving your pain problems. So this exercise is going to take a little bit of explaining because it's not so much the movement that you do, but it's how you think about the exercise and it's how you perform the exercise. Like I described earlier, your muscles are in a high state of alert, and the movement that you do to sort of take that alert level down is going to be a gentle one. It's not going to be any strain. You don't want the muscles to fear any movement. You don't want them to overreact to anything you do. So the slower and the more gentle you move, the better. So please keep that in mind when you're doing this. I understand that if you're having a hard time getting range of motion back, if you've been pushed, if you're frustrated with your progress, you have a strong desire to get better as fast as you can, as quickly as you can get there. And you have to temper that for just a little while longer until your body starts to take away its alerts and move away from that guarded, overactive state. It will come, but you need to allow your body the time to do it. And the sooner you can let go of that expectation and the desire to get better as quickly as possible, the faster you'll get better. I promise you. This has worked with a number of my patients. With the patients that come in with the significant problems with their range of motion, this has helped significantly. So this exercise I'm going to show you is done lying on your back. So we're going to get to that position.
So here I am lying in this position, knees bent up, feet, you can start with your feet flat. I have a towel underneath my heel here just to help my foot slide along this vinyl surface of the treatment table. But if you're doing this on your bed at home, and it's fine to do this on your bed, I recommend doing it on your bed so you don't have to get out and off the floor. There is not going to be as much friction and sticking, so you shouldn't need anything to help you slide. This is just here for me and to show you how this exercise should allow your leg to move. So again, we start with a very relaxed body, not a lot of pressure, not a lot of force, super gentle movement. The motion looks like this. You're just going to slide your heel away from you as far as you can go without any pain. And then you're going to slide your heel back as you bring it toward your bottom. Now, you may be doing this exercise already, but it's likely that the therapist that gave it to you is instructing you to do it in a different way. Pull up as high as you can and as far as you can, and push your leg out in front of you as far as you can and as hard as you can. That is not what I want you to do. This is about gently moving it away from you, getting to where you can go without pain, maybe a gentle stretch. But I also want you to monitor how your body is reacting when your leg moves out. If you feel yourself tensing up, that is indicating that your body's at that high alert state and is not going to allow you to move easily. And I want you to stay away from that state as much as you can. So it's really important that you take that time, take that little bit of effort to not allow your body to go there, even though it may feel like you can move a lot further. This is not about how far you go. It's about getting your body to decrease its alert state. So again, making sure you're nice and relaxed, your leg is moving gently and easily, it's not overly contracted, your body is not resisting, you're just allowing your leg to move easily all the way out into extension, gently up into flexion. Easy, and practice. The more time you spend doing this, the more your body will drop down from its overregulated high alert state. It's really important to remember that you don't want to push super all the way up to where you feel a stretch and all the way down to where you feel stretch or strain. I know you're used to feeling that when you're doing exercises for range of motion, but you only want to move as far as you can, just to the point of maybe feeling a slight stretch, but not a strain. And you don't ever want your body to react. You want the leg to be the only thing moving and not into pain. You really have to fight your desire to get it to move more so that you're not pushing it beyond what it's capable of doing.
Thanks for watching. Be sure you listen to your body and stop immediately if you have pain. As I promised earlier, I have that special gift for you. All you have to do is click the link down below in the description, and it's going to take you to a page where you can get access to my Healthy Knee Guide PDF. If you learned anything helpful, please share this video with a friend and click that thumbs up button. If you're new here, hit that subscribe button so you can get more tips and tricks for pain relief and corrective exercises. Be sure to leave me a comment letting me know how this worked for you or other pain relief tips you'd like to see. Until next time, take care of yourself.